Dear mom, thank you for choosing to be my mom and raising me and for still helping me in the ways that you do now that I am an adult.
For Julia Holliday, this letter from her daughter is a reminder of who she used to be before the meth addiction, before the countless psychiatric hospital stays.
I have been challenged by my loved one, my daughter, for 20 years. She was diagnosed at 16 with bipolar disorder, with uh, auditory complications.
Julia and her husband Kirk are among many families dealing with what's known as dual diagnosis, when someone struggles with both a mental illness and substance use disorder. They've tried drug treatment programs, conservatorships, and extended hospital stays, but their daughter leaves after just a few days against medical advice.
Turn 18, things change fast, and you don't even realize the significance of that until you're faced with trying to get information, trying to help.
The older she gets, the tougher it is to intervene.
The most challenging part for me is grappling with the idea that she's beyond hope.
Their daughter is now 36. Julia says she just got evicted from her apartment and is living in a motel. That's where Senate Bill 43 comes in. The law updates California's definition of grave disability to include people with severe substance use disorder. Julia read about it in the newspaper.
I was so excited. I said, "Oh, this could be actually it," right?
She asked her daughter's psychiatrist about it.
And they were kind of a wait and see attitude. Let's see how it goes. Let's see how it navigates through the system.
The county has had a year to prepare for the implementation of the new law. Dr. Luke Bergman says they've trained hospital staff, first responders, and peace officers how to apply it. They also partnered with the National Alliance on Mental Illness to raise awareness about who it's meant to help.
I would say that implementation has gone pretty well, primarily in that we haven't seen huge numbers of people detained and transported for care under the terms that SB 43 establishes.
The county is expected to release the first numbers in June on how many people have been detained under SB 43. But for the holidays, whose daughter was just in the hospital again a few weeks ago, the new law hasn't changed much for them yet.
Like, it was never mentioned once in the 5 or 6 weeks my daughter was in the hospital. Maybe there could be some advocacy, more advocacy on it, or maybe outreach to families and say, "Hey, we're going to have an orientation about this."
At Sharp Grossmont Behavioral Health, lead social worker Candy Elson helps families navigate these difficult decisions.
It's very difficult to help them stay in the hospital for a long period of treatment if they don't want to be there. So I spend a lot of time explaining to families the nature of the mental health law in California, the limitation of resources.
She says SB 43 is well intentioned, but hard for families to navigate.
And I sometimes say it's like false hope, because if your family member still says, "I'm not going to get treatment, nothing's going to happen."
Involuntary treatment is possible, but it requires intervention by the court. Still, the Holidays hope that the next time their daughter finds herself in crisis, the new law can help her.
Well, I just hope that people who have family members, friends, or other people in their lives who suffer from mental illness and dual diagnosis don't abandon those people.
Heidi de Marco, KPBS News.